The second wave of COVID-19 hit India very hard, and its ferocity caught the government, the medical fraternity, and the people by surprise.
Severe second wave of COVID-19 is threatening to overwhelm the country's health systems.
The rate of increase in the new cases is significantly higher in the second wave of COVID.
Many parts of the country are reporting hospitals being overwhelmed, oxygen shortages.
Combating the second wave required all hands on the deck, all resources to be pooled to provide support and pull the country out of the crisis. And in this hour of need, ArcelorMittal and Nippon Steel India came forward to stand in solidarity with the people and the government, not just in lip service, but in on-ground action. Most critical of supplies needed was oxygen, of which there was acute shortage across the country. To this end, our facility in Hazira, Gujarat spearheaded our efforts by supplying over 200 metric tons of liquid oxygen every day to medical units in need, which was soon stretched to 250 metric tons per day. From the onset of the second wave in April till date, the amount of liquid medical oxygen supplied by us is equivalent to oxygen requirement of nearly 9,20,000 patient days. Increasing caseload was leading to scarcity of hospital beds. We stepped up and set up a 250-bed hospital near the Hazira plant in just 72 hours.
मेरे को याद है कि प्राइम मिनिस्टर ने मोदी जी ने मीटिंग की थी और उसमें कुछ इंडस्ट्रियलिस्ट को बोला कि आप क्या कर सकते हैं, ऑक्सीजन की शॉर्टेज है, आज कमी है, और हमने तुरंत अपनी टीम को इस काम के लिए लगाया। ये एक नई आइडिया आई कि एक हॉस्पिटल फैक्ट्री के बगल में ही बना दिया जाए।
3 दिन में 250 बेड वाली हॉस्पिटल आप लोगों ने जो व्यवस्था बनाई है कि आने वाले दिन में 1000 बेड वहीं आपकी इंडस्ट्रीज में ही इतनी बड़ी हॉस्पिटल विथ फुल सपोर्ट।
The hospital is equipped with gaseous oxygen, has WHO certified doctors and nurses to offer the best care to the patients, and can be scaled up to 1,000 beds.
3 weeks back, Surat faced one of its worst oxygen crises. Every 3 hours, we would be at a situation where we would face the dilemma where the next oxygen cylinder after 1 hour is going to come from. And that is when, luckily for us, AMN has stepped in to provide us with the necessary oxygen. And here, the biggest advantage is that there is no short supply of oxygen. So that has proved a real boon.
I got all the best facilities over here. There was no problem for my recovery, and I have recovered very well, and I will be discharged today.
Our efforts were not restricted to just one location. The oxygen was transported across states in cryogenic containers. Over 7,000 oxygen cylinders were imported. Life-saving drugs, PPE kits, sanitizers, masks were also distributed in various states to smaller hospitals and also the frontline workers. The situation is still grim, we know, but we have all joined hands to fight it together, and we shall overcome.
We at ArcelorMittal and Nippon Steel are determined to stand shoulder to shoulder with the government of India and its people, and we will leave no stone unturned in overcoming this particular crisis.